infrastructure to ensure that there's connectivity through the local area network, wide area network, and fiber. We are working together very well, and they are assisting us even in development of our other areas. Your Excellency, at the middle here, this is the National Core Digital Health Services. And in this National Core Digital Health Services, Your Excellency, what you see in green, Kenya Community Health Unit Registry, Kenya National Health Terminology, Kenya Health Facility Registry, we have already achieved. That is why they're in green, to mean that we know all the facilities that are within this country under the Kenya Health Facility Registry. We also know the Kenya Community Health Unit Registry. Remember, we have our community health promoters that link up to the community health unit. We already know what it is, and we have the terminology area. Your Excellency, we are working together with the Ministry of Interior so that we have the unique identifier. Once we have it, then we go ahead and continue development of the Kenya Client Registry. That the unique identifier from Ministry of Interior is the same one that a Kenyan will use to access services all throughout. Your Excellency, last week we launched with you the Human Resource Advisory Council. We want to have a registry of all health workers, that we know who they are, we know their cadres, we know how many years of services they have already done, when they will be retiring, and we can as well know how we transfer them from one facility to the other based on need. Your Excellency, all this done, we have a national shared health records. This national shared health records, Your Excellency, means if a Kenyan is accessing health services from whatever point, they don't need to move around with any kind of documentation. Remember, there are places that you go and you spend time kwa sababu wanafungua file. So we shall no longer have kufungua file. You have your unique identifier that you walk through, and the records here are shared. Should one be transferred from one level of service to the other, they will find their records there. Your Excellency, on this other side, we have what we call the support services, where we have the electronic claims management system. The issues that we are having at NHIF, Your Excellency, those are going to be a thing of the past. Because as you move through the services, there is an invoice that is being generated automatically. Your Excellency, it is based on the costed items that we did. We have an itemized invoice. So the people here, their work is just to do claims management. Then we have telemedicine, Your Excellency, and we also have the National Logistics Supply Chain Management Service. This is where our KEMSA for health products will plug in. All the brokers in between, we are working towards removing them, Your Excellency. On this side is what we call point of care. And Your Excellency, you'll be pleased to know that one of our national referral hospitals, Moi Teaching and Referral Hospitals, you can book for an appointment online from your phone. You go through, you find they are prepared for you. Every point of care that you go through, your name and your details are already there. That is what we call point of care that will take care of inpatient and outpatient. Your Excellency, we have ICHIS. This is our app for the community health promoters. We have already trained them. They'll be collecting data. All this data then filters through to the national shared health records. We have a digital kiosk, Your Excellency. This digital kiosk is meant to create employment for the many qualified health workers who do not have a place to practice, that through their gadgets, then they can link up and even provide services to patients. And lastly, we have other point of care. Your Excellency, all this that you see here is the Kenya Health Interoperability Services. To mean all facilities, including Nairobi County, they have some form of digitization. But now we are providing this platform so that they are able to link through. Our aspiration, Your Excellency, is that all Kenyans will own their records. Besides owning, they will control who accesses and how they access at each point of care. Let's go to the next one. Your Excellency, this is a patient journey. Should one get unwell, this is where they start from the community level through our community health promoters, through this application eKais. And all this is logged onto eCitizen, Your Excellency. They come to the facility level where they are provided for services. Depending on the level, it could be level 2, level 3, up to level 6, where there is referral. Your Excellency, the previous showed you, this is now electronic claims, where our reformed NHIF is going to be, and the other social health insurance scheme. Your Excellency, then we have the back to the community for those who need rehabilitation services. They'll be sent back to the community, and we have our shared health records. Your Excellency, we have moved further at the ministry, we have a total of 28 active agencies. Of the 28 active agencies, 12 have already onboarded on eCitizen. We have mapped out all the services that we need to onboard on eCitizen. Almost 590 are mapped, but 414 are already linked on eCitizen. Let me allow my peers to demonstrate the other two active ones.
Thank you, Excellency. Just to demonstrate to you, we have a few of those services that have been onboarded. One is through DAMU Kenya. We call it DAMU KE. The DAMU KE is an end-to-end management information system that automates workflows of the management of blood and blood products from vein to vein national, meaning from the donor to the recipient. The system facilitates track and traces assuring the transparency, accountability of the donated blood, because we want to make sure that that blood that has been donated is accounted and can be traced back to who donated this blood. So this system, Your Excellency, it's all in the. Here is where you do the registration, so the citizen comes and his or her data will be captured, and once that is captured, then the end here is the donation certificate, but in between here is what takes place, screening of the blood and all those things. All that now is online. So that's the certificate, Your Excellency. And then this is the pharmacovigilance electronic reporting system, where we give the patients to report cases of where there is adverse reaction or where they suspect that some of these medications that was given are not correct. So we have also put this in the eCitizen, where they register, and this will be how they will be worked on. And then finally, there is a certificate, there is a registration form that they will get, they will fill. So this is the form they fill when they have suspected adverse drug reaction, where they report that they have these cases. Thank you. We have Jali. This is a very interactive system, Your Excellency, and this one now calls upon that if you have your mobile, we can start. As a citizen, my colleague will show you how the citizens will access it, but the most important thing is the WhatsApp number, 07007199719. Yes, that's how it works, Your Excellency.
Once you scan, then you're taken to WhatsApp, and you're able to ask any question that you would want the chat box to.
Okay. You start with hello. So you start communicating.
Yes.
Okay.
So thank you.
Menu, Your Excellency.
Gives you
so
the menu.
If you want to know about your lifestyle and wellness, you type 1. But in this, what we are going through right now is to increase accessibility. And therefore, I'll ask my PS to type 10, this locator. It locates to you the facility that is closest to you.
No locator.
No, we want it to there. It is there. It gives you a link. A link that you can click on. It tells you what facilities are next to you, that then you can go to access services.
So those are the services, and they tell you how far it is. I can see on the side.
They give you the distance.
Okay. So, Waziri and your team, what is very important to the ordinary person pale nyumbani ni kujua hawa community health promoters, yeah? What kind of service are they going to offer, and the data they collect from citizens? How have you made it possible for that data to be aggregated so that we can know what is the prevailing, disease burden situation in every part of Kenya?
Thank you, Your Excellency. The community health promoters have a gadget. On that gadget, we have an app.
The gadget will be supplied by the government of Kenya.
By the government of Kenya, Your Excellency. Over 100,000 community health promoters, each will have a gadget. That gadget has an application, the EKS. Besides that, Your Excellency, each community health promoter has a kit. inside that kit, they have basic first aid. They equally have those things that they can use to check the temperatures, to check the blood pressure of each member of the individual household. They will collect that data through the EKAIS application. Let's go to EKAIS. And on the EKAIS application, Your Excellency, are you able to open it live, the EKAIS? That after they collect that data on EKAIS, we able to have access, because it then reports to the National Health Record Services through the code that I explained previously. And from the national level, Your Excellency, we are able even to tell how many times a community health promoter has visited a household. If they have not visited, we are able to tell from the EKAIS from the national level. Then together with the counties, we are able to redirect them and tell them that this community health promoter hasn't visited. You see, like here, Your Excellency, it is showing that they visited a household that has mother and newborn, and they are in 2 days' time, they should be visited. This one here was not visited. Jane Kamau, these are household. They ought to have gone, but they did not go. They were due yesterday. So this application, Your Excellency, it is able to assist us to monitor the performance of community health promoters.
Very good.
And based on the data that they are collecting here, you can see, we can generate reports now.
Very good.
And based on these reports, then we can even tell what is the prevalence of disease in certain parts of the country. We use it for the national decision making in terms of where should we focus on specialists, where should we focus on the health products to procure.
Okay. Waziri, one more question.
Yes, sir.
You know the big problem we've always had with health commodities and KEMSA.
Yes.
How is this process of digitization, which we discussed, how will this process of digitization assist us to get rid of the challenges we have at KEMSA?
Thank you, Your Excellency. Now, on this core, Your Excellency, we have point of care. Point of care, they are recording what is happening at each level. For example, if a pharmaceutical drug is being dispensed, paracetamol at each level, it is visible here on the digital system. When it is being dispensed here, the person at the end, HPT supplier, that is KEMSA, they are able to see that this drug is going down. So then it assists them in their operations to ensure that then they reorder and restock on that. On the other end of KEMSA, Your Excellency, are the manufacturers and vendors, that they are able then to monitor stocks within here. So what this system is doing, Your Excellency, it is removing the brokers that were in between. In terms of, and what they were doing is just to increase the cost of products. So now with this system, it cuts out, because KEMSA has visibility of usage of the products on this end, and on this side, they have control because they have communication with the suppliers and the manufacturers of the items, Your Excellency. Similarly, Your Excellency, this system, it eliminates all the issues that we have had regarding claims at NHIF, because we have an electronic claims management system here. When this patient is going through all the services, information is being collected. So now you cannot introduce a fake patient in between, neither can we introduce a fake service in between, because we have an itemized invoice managed with an electronic claims management system.
Wonderful.
Thank you, Your Excellency.
Thank you very much.
Thank you, Your Excellency. Welcome to the Ministry of